Do I want to mix up my words anymore? Okay, so today I'm going to be talking about a little bit of a different topic. If you couldn't tell by the title, I'm going to be speaking all about my skin, my acne, basically what I went through with it and how I went from this to this. Yeah, it was a bit of a journey. It did take quite a few years for me to actually get on top of my acne, to clear everything up, but it's a lot better now. To give you a bit of background, I started getting pimples and little spots around the age of 11, I would say. I was still in primary school and it wasn't anything major, just mild acne. At the time, I wasn't too fussed by it. I didn't really think it was anything out of the ordinary because I was starting to go through puberty anyway, and I was kind of anticipating having the odd spot here and there. In terms of how I felt about it, I was a little bit too young to care as well. So I think that was a big factor as to why when I was around 11, 12, I didn't really care so much about what was going on with my skin. Well, all that drastically changed about a year later when I started secondary school. Annoyingly, this was when my acne started to really flare up. I was getting a lot more spots kind of around my T-zone, especially on my forehead, and I started to get very painful ones on my lip as well. This was the sort of point when both myself and other people were starting to take a bit more notice of people's appearances, shall we say. I guess acne, how you look, all that kind of stuff was a big topic of discussion, or felt like a big topic of discussion around that time when I was moving to secondary school. It did actually take a fairly hefty toll on me, I will say that, especially when I started to hear people make passing comments about my skin. I distinctly remember actually a boy saying to me / about me, I don't think it was to me, but it was about me, saying that he would have gone out with me had I been less spotty. And I still think about that. It does stick. So yeah, that wasn't the nicest comment in the world to have said about yourself, but I guess at that age, like, people just don't know any better. People don't realise that saying stuff like that can actually really hurt your feelings. Of course, I will say as well, I was not the only person with bad acne at my school by any stretch of the imagination. That's not what I'm trying to say at all. But I do remember starting to get very disheartened when other people's skin started clearing up and mine was only really getting worse. Of course, it's understandable for people to get acne at different times, people to start going through puberty at different times, but I just felt as if I'd been going through it a long time, and the people who had kind of started puberty at the same time as me had started healing from their acne, and I just wasn't. In terms of treatment over those first few years in secondary school, I worked my way through pretty much every single over-the-counter medication, gel, cream that I could find with a pretty low success rate. I would see marginal progress and small improvements, but then my spots would just come through even more fiercely than they were before. I used to have frequent appointments with my GP in which we talked over my options. We tried me on various different pills to try and combat the hormonal side of my acne. I also remember going through every single topical treatment under the sun. Yeah, again, as I said, none of these were very successful in treating my acne. At around the age of 16, my skin was probably at its absolute worst. I had huge cysts on my cheeks and my forehead that were really pretty painful, and at this point I honestly felt like there was nothing that was going to cure my acne. Because I was genuinely struggling so much and we weren't actually getting anywhere with the GP, my parents very kindly offered to take me to see a private dermatologist. The one I went to see was called Dr. Jonathan Bowling at the Manor Hospital in Oxford. We talked through various options, we spoke through the medications I'd tried before, and the doctor I saw did recommend isotretinoin, which is more commonly known as Accutane. Both my parents and I did have reservations about this treatment because it can be pretty nasty and it can have some fairly adverse side effects. However, it is known for being one of the best treatments to cure cystic acne, which was what my acne primarily was. In the end, we decided this was probably one of the only treatments that I hadn't tried and that it was worth a go. Now, when you go on Accutane, you do need to take a couple of other tablets as well. As a woman, you must be on birth control because Accutane, or isotretinoin as it's more formally known, can cause birth defects in an unborn child. And obviously this must be avoided at all costs. So throughout my course on this treatment, I also took the contraceptive pill Dianet. You must take this as a female regardless of your age or sexual activity or anything. It's just a must. To go along with this, you also need to have regular pregnancy tests every single month, just to ensure that the pill is working fine. Again, throughout the duration of my treatment, I also took the antibiotic erythromycin. This was used in combination with the Accutane just to try and improve the bacterial side of my acne. In terms of dosage for the actual Accutane, I started on a fairly low dose. I think I was on about 20 milligrams. This was just to ensure that my body was responding well to the treatment and so that we could anticipate and control the severity of the side effects. Again, I'm not entirely sure because I was on this treatment in about 2016 or 2017, but I think after the first month I moved up to 40 milligrams a day. I do believe you're not meant to surpass a milligram per kilo of body weight per day. So in my case, that would have been about 50 milligrams. Yeah, as I said, we ended on about 40 milligrams and I stayed on this for probably about 4 or 5 months. Another thing to bear in mind is you will have to have regular blood tests. This is again because the drug can be fairly nasty and they do need to monitor your lipid levels. Again, just to make sure that there's nothing out of the ordinary and to control and notice any problems before the harm is done. I don't think this was monthly like the pregnancy testing was, but I think it would have been at least every 2 months that I had these blood tests. As I previously mentioned, one of the things that I was pretty concerned about before starting this treatment was actually the side effects. So I thought it would be pretty helpful for me to go through a few of the common side effects, a few of the more serious side effects that should be considered, and also to talk in more detail about the side effects I personally experienced. It's very important to note that side effects will differ from person to person. You may be really lucky and your body responds to it really well and you will have very few, or you may need to take a lower dose if your body is having a hard time taking on this drug. So one of the most common side effects that I'm pretty sure most people experience is dryness. Now, I got dry everywhere. My mouth was dry, my lips were dry, and extremely dry in fact, to the point where I was putting lip balm on every couple of hours, every hour even, just so that they weren't cracking and bleeding. I also found the skin all around my body was dry, so I had to moisturise a lot more frequently than I usually would. The spots started to dry up as well. So one of the most important things I found was just to carry on moisturising, even if you think it's making your skin oily or greasy. Just use a water-based moisturiser just so that your skin doesn't dry and crack, because trust me, it can be very, very painful. One of the very serious side effects is actually what this medication can do to your mental health. It is still considered a less frequent side effect, but many people still have reported an increase in anxiety, panic attacks, a low mood, and this can also trigger depression as well, which is most definitely something to acknowledge before deciding to take this treatment. For me personally, I didn't notice anything too out of the ordinary. I did go through short phases of having low mood, but compared to what my mental state was usually like, it wasn't too different. However, I did notice my concentration was considerably lower than I perhaps expected it to be. I was taking mock exams at the time, and I did notice that these were a bit more strenuous on me. Another thing I found was that I was getting mouth ulcers all the time. And I'm not just talking about, you know, the odd 1 or 2 mouth ulcers. It wasn't uncommon for me to have probably 6 to 8 mouth ulcers at a time, which, as you can imagine, it is extremely uncomfortable. It made eating fairly difficult as well, but it's a side effect that I would happily deal with for the purpose of having nicer skin. And another thing I will say is, when you do start the treatment, the doctors will tell you to expect your skin to get worse, considerably worse, after the first 2 or 3 weeks, and remain this way until the kind of Accutane kind of kicks in, which is usually around 2 to 3 months. Don't be disheartened if your skin does not improve within the first week, 2 weeks, because it will get worse, unfortunately. Whilst the worsening of my skin was a little bit disconcerting, once the improvement started, I really did notice my skin drastically changing in a positive way, so that kind of made it all worth it. I continued this treatment for about 6 months before lowering my dose and eventually stopping. Treatment time can vary person to person depending on the severity of your acne, depending on your body's response. Once I stopped taking the Accutane itself, I did stay on the antibiotics for another couple of months just to ensure that I wasn't taking away every single variable that was improving my skin. So that brings us to where I am now. I have been off Accutane for between 2 and 3 years, I believe, and honestly my skin has not been this good since I was a child, so I'm incredibly grateful for how I responded. I'm incredibly grateful for having this treatment as well. My skin definitely isn't perfect. I still get pimples, I still get redness and dullness in my skin, but honestly I couldn't be happier. These imperfections do go away when I apply makeup now, which didn't happen before. I do have scarring, which is inevitable really if you get these big cysts on your face, but it is slowly going, and I will probably do an update on this video once they're fully gone, so I can talk through products that improved this and help me get rid of the scars. To round this video off, I can fully sympathise with anyone who has gone through this with acne or something similar. Acne can be extremely mentally trying at times. Of course, there are much worse things you can go through. I'm not trying to take away from that at all. This is, well, mostly cosmetic, I guess. There are people going through a lot worse. I'm not trying to take away from that at all. But acne is still a struggle, and if the information in this video can help even just one person, then I'll be really happy with that, because I know that personally if I had seen a video like this, I would have had a lot more hope. So that is one of the main reasons that I wanted to film this, as well as it being informative. But I am always more than happy to help or speak to or offer any advice to people going through something similar with their skin. So please just pop me a message over on Instagram and I will do what I can to help. So that brings us to the end of this video. But yeah, thank you for watching and I'll see you in the next one.